just because it's common doesn't mean it's normal, and normal should feel better than this.
Hi, I'm Cheryl Medeiros.
And I'm Colleen Hungerford. And this is We're Doing This Right, right? Podcast for the whole woman, mind, body, soul, and business.
It's humor infused, as real as it gets, inspiring, and you'll walk away with real usable tools for life and business.
If you love what you're hearing, please share with a friend, subscribe so you'll never miss an episode, and rate and review whenever you listen.
So find your earbuds, lace up your walking shoes, or cozy up with a beverage of your choice. It's time to dig in. Hey, hello everybody. Welcome back to another episode of We're Doing This Right, right?
Hello.
Hi, Colleen. And you guys, today we have a really awesome guest. Lauren Edwards is here. Say hello, Lauren.
Hi.
Lauren Edwards. I met Lauren Edwards between my second and third baby. She is a pelvic floor rehabilitation expert. She became interested in rehabilitation after experiencing her own firsthand trauma during childbirth and the lasting impacts that had on her physical, emotional, and psychological health. As a trained occupational therapist, Lauren understands the value of an evidence-based, holistic approach to understanding a very intimate and often misunderstood component of the female body. She provides comfort, confidence, and understanding to help you regain strength control, starting with your pelvic floor. So I met Lauren because when I was pregnant with my second daughter, Emmy, I've got suspicions about what was going on, but basically I had a chronic cough through the entirety of my pregnancy with my second child. And the amount of times I peed my pants was stupid. It was stupid to the point where I literally, if I had to go to work, started wearing Depends because I couldn't stop the cough and I couldn't stop the peeing and I couldn't stay home.
I remember you telling me that.
Yeah. I was like, I don't know what else to do.
I remember the Depends vividly.
Yeah. So I went to my OBGYN after I delivered my daughter and I said, I'd like a referral to a pelvic floor specialist. I only knew about this because shout out to Brittany Pomfret, who is like all things baby, postpartum, perinatal, all the things. And she's like, you gotta see Lauren about your pelvic floor. You got to see Lauren about your pelvic floor. So I asked for the referral from my OBGYN. And she says to me, well, don't you want another baby? Why don't you just wait till you have your next baby and then go? And I was like, oh, actually,
my favorite.
Yeah. And I love my doctor. Don't get me wrong. She just is missing like the beat really on this one. I'm like, well, I don't particularly want to be like peeing my pants until my next baby comes out. Like I've got some postpartum to get through here. And then I have another pregnancy and like, oh my God, how weak will my pelvic floor be by the end of all of that? So no, I urged and pushed for the referral right then, which ladies, you can do that. You can tell your doctor, no, I want this now. And I encourage you all to do that. So I asked for it and I met Lauren and it was incredible. She was amazing, super comfortable experience, very intimate as mentioned before, but it was incredible. And what I learned a lot of things in that, but what I found really interesting was I thought I was like squeezing and doing a Kegel. And she had these biofeedback sensors on the inside of me and she could see that like I squeezed and I still thought I was squeezing, but I had no endurance and the muscle just like let go after a second, which was why I could cough once and not pee. But if I coughed twice, I was fucked and was peeing my pants. So Lauren saved my life on that. I probably need to revisit, but Lauren, why don't you tell us about you a little bit now that people know that you're here to help me stop peeing my pants?
Sure. So I have been an OT for over like 15 years and I've been in the hospital setting. I had my son, which is who you reference having had the traumatic childbirth with. Essentially, they had found a defect in utero when I was 32 or 34 weeks pregnant. So I was at Santa Barbara at the time. I had to relocate to LA and I really had no idea about my pelvic floor. I actually was having a relatively smooth pregnancy, so I didn't have a lot of complaints in that department, but I had to deliver my son after a 42-hour induction in a surgical suite with 35 people present. So he had his own team and I had my own team. It was a very, what I would call like patriarchal system. You got an epidural, you were given your pain meds, you got an episiotomy, end of story. Like there wasn't a lot of conversation. There wasn't, can I, let me give you some education and offer you something. It was, I'm going to do this on you. So I just wanted my baby safely earthside. I remember just giving everything I got. Now looking back, I didn't know how to push a baby out, and that's a whole other conversation. But in the end, I was just leaking. I had pain. My episiotomy would pull every time I was seated. So I actually wound up going to a pelvic floor therapist who was like, okay, yeah. And the first thing she said to me is, "You're an OT?" I said, "Yeah." So it's very different. There's physical therapists and OTs. We believe we all share the same space, but typically PTs have dominated the pelvic health world. And she said, "I've always wanted an OT to work for me. I want to train you." And I was like, okay, let's do it. It was just kind of serendipitous, and it really worked. And so that started my journey. I was able to recover from predominantly stress incontinence, which you were describing as well. So there's a lot of different types of incontinence, which really kind of gets people's heads spinning. Stress incontinence being the most common. And so one of the things that I took away from my visit was like, oh, my pelvic floor is actually not weak. It's too tight. And like you mentioned, I didn't have any endurance and I had no coordination. And then one of the other biggest issues was my core didn't work. I had just an absolutely shot core. And so what I've learned now, I've been doing this for almost 6 years, is that it's so much bigger than the floor, right? And there's so many factors. And so these clients will come in now and be like, I didn't know you look at my rib cage and how I breathe. And, what is my stress level like? Like I'm talking through being a new mom or maybe not being a mom, but what are some events that have happened in your life, right? And it's so that's what's been cool is I've watched myself move from a very like clear cut biomechanical approach, which is very much like, what does the muscle do, to like, who's in the house and who's the neighbors and who's causing the problems. And one of my biggest taglines is, just because it's common doesn't mean it's normal, and normal should feel better than this. So a lot of times they'll say, in your case, well, it's normal. You're pregnant. You've had babies before. It's normal that you're leaking. It's not. It's common, but it's not normal. And so that's always been my big soapbox I stand on for most of that.
And in addition to it not being normal, is there's something you can do about it.
Right. Right. No.
Well, and I think that's such an interesting differentiation between common and normal.
Right.
Like because you hear it all the time. Like it's normal. It's normal to pee your pants while you're pregnant. It's normal to jump on the trampoline and pee or whatever it is, right? But what I'm hearing you say is like, it's actually not normal. Like that's not normal, yeah. But it is so common that we're just accepting it as a normalcy.
Yeah.
And that's kind of insane that we're just like, great, there's this massive problem that's happening for a majority of women, and we're just going to call it normal instead of tackling that problem or making something like your services more well-known.
Yeah.
Like, because I think there are a lot of women that don't even know that they should be seeing a pelvic floor specialist, or even what that is, or even what that entails.
Yeah. And one of my big moments too is that I feel like we're missing a huge group, and that it's okay to talk about your problems when you've had a baby, but you don't get to talk about it before you have a baby. But the amount of women that come in who cannot conceive because pain or intercourse is painful, that they've been leaking since they were teens. There are so many risk factors for pelvic floor dysfunction that, yes, a baby is probably the most common. Whether it's a C-section or a vaginal birth, you have overworked your pelvic floor. But being a high competitive athlete, whether you're doing gymnastics, dance, CrossFit, having a chronic cough, having been chronically constipated a period of your life or your whole life, having fallen on your tailbone, having a history of sexual or a verbal abuse. These are all risk factors. So what some poor women are doing is going to their OB so shameful. They're 20 and they're being like, hey, intercourse kind of hurts. Oh, honey, just wait till you have a baby. It'll widen it up. It's all this very dismissive and kind of, like I say, like patriarchal, because it's not about us, right? It's not about women, but there are so many things we can improve in the quality of life if we just advocate for ourselves. And I will say, Cheryl mentioned like, oh, my OB had to really fight. You can self-refer. Most insurance companies let you. And actually, I run a cash-based practice for this reason. You call me, you come in. Like there's no one's in our way. Obviously financial, but you don't need a referral for a lot of services. So it's important for people to know that as well.
That's good to know too. And how, I guess, cooperative is insurance in general for your patients, have you found?
To be honest, they can be pretty, if you've had a child or had a surgery, your out of pocket's been met. And so they will then reimburse at a pretty high rate, like 75% of my services. There is a law, and I wish I could tell it off the top of my head, but essentially if you cannot get into an in-network provider within 30 days of receiving a referral, which is very impossible to do in this community, your insurance will then need to cover at a certain percentage for an out-of-network provider to meet your needs. So you can always really advocate for yourself. Yeah. So you call and just say, hey, or I specialize in pregnancy, postpartum, and pain. Pain's one of my like passions. And a lot of times you can just call and be like, hey, there's no one in my area that does this except for this clinician. And that's who I want to see. And they do have to respect that you need a specialty. And that's what I do. So sometimes it's just a matter of getting on the phone and being really annoying, but you can be provided with like a fancy receipt. We call it a super bill where you get reimbursed. I really believe like I work myself out of a job. I don't really want your guys' money that bad. I like to have a job, make a living, but my goal is to get you better. So we try to be as concise as we can. And really, I put it on you like, hey, this is your homework. And then I'm going to coach you through that. So it is sometimes overwhelming to think about, oh my gosh, it's going to be so much money. But at the end of the day, it's really just me putting these pieces in play and really just educating people. Education is half of what I do. I'm sure Cheryl can note that. But just talking about this is what's normal. This is what's not. This is what peeing and pooping should feel like. People are like, when I say like peeing is a passive activity. Like you sit on the toilet and pee should just happen. We shouldn't push. We shouldn't strain. We shouldn't dribble after we pee. And those are all little flags that are thrown up that are usually an indication of dysfunction.
That's so interesting. Like I've never thought about how I pee. And I was trying to like sit here and think like, how do I pee? How does it feel when I pee? But I don't know that it feels like what you're describing. Like I just...
Yeah, a lot of people want to push. Like they got places to be. There's a kid screaming, a dog barking, a husband, doing something. So most people are also blown away when I explain to them that pooping is should not hold your breath and you should not squeeze your poop out. You should just inhale and the rectum does its job.
Well, I need to see you. What's happening? What the hell, man?
And then the other...
Everyone should own a squatty potty.
Oh, yeah.
The other really interesting thing I learned was what our belly and our diaphragm should be doing when we're breathing. So can you tell us that? Because I don't understand how everybody's wires get crossed on this.
Sure. Well, I will say I should have brought more props. I brought none. I'm sitting in my house. But essentially, we are built like a little canister. So the top of us is our respiratory diaphragm, and the bottom is our pelvic floor. So before we get constipated or have anxiety or our parents push us to pee before we leave the house when we're a kid, we have this beautiful system is when we inhale, we let everything go down. And then as we exhale, it comes up. So I'll have women come in and be like, oh, I do Kegels all the time, Lauren. I'm really good at them. I'm like, great, hit me with them. And the first thing they do is suck up. And I go, well, that was really fun. But no muscle participated other than your diaphragm lifting up on your pelvic floor. The actual muscles were just like, okay, here we go, right? Like they didn't participate. So what we spend most of our time talking about is, can you breathe in and let your pelvic floor drop out? So that should feel like almost like a bearing down or a bulging. And then when you exhale and contract, that's your actual Kegel. You won't catch me often prescribing those, but that's how the system is designed to work. And what happens is we come from a sucking in culture where we are always sucking in the lower abdomen. So that doesn't let the diaphragm do its job. So we naturally have locked down the pelvic floor by not letting the abdomen move freely. Plus, a lot of times we just don't breathe effectively. So the diaphragm, one of the first things I'll do is release your diaphragm so that your diaphragm can get out of your rib cage. When you're pregnant, it thickens by 50%.
Whoa.
and your rib cage, I'm sure you can all relate. You went to go put on your old bra and you were like, so now my rib cage is bigger, right? It's not just your boobs, it's your rib cage. And it's because the diaphragm got so big because it was trying to keep your organs down. But now, instead of having this cute, pliable, balloon looking concept, it's really thick and hard. So that's another issue is we're breastfeeding, we're hunched, we're carrying our baby around, and that diaphragm now is not moving. So the pelvic floor is doing the exact same thing. So one of the best things you can do is practice diaphragmatic breathing.
Well, and I think when you talked about the ribs, like that has been, I know for me personally, like when that even like before I had kids, you carry stress, like I would carry stress and I feel like my ribs were always like up. And I used to work at a physical therapy clinic and I had a PT once release my ribs. Like she did this myofascial technique and my ribs went from like flared out to down for the first time in my like adult life. And I had wanted someone to do that for me post 3 children, like for ages. Cause I just feel like they're up, right? Like it's hard to explain, but they just feel like they're up and I need them to come down. And I had a chiropractor one time that told me that we carry that our rib cage is emotional and we carry a lot of stress in our rib cage.
I believe that. Yeah.
And I was like, wow, I feel that so much because what all you're saying, and Cheryl and I have 3 children also. I had them in a similar time period. And it's like your body just becomes this machine that is pliable and will do whatever it wants and needs. Basically, will do whatever it needs to make these babies and make them comfortable, right? And I had my middle son was 23 inches long. Like he was huge.
Oh gosh.
So I feel like I'm like, what happened inside here? Like, is everything okay? And like, so
and it typically is not. It's you're rearranged. Like you're so rearranged. And actually, with a C-section, you don't get the luck of the baby sucking your organs back home because that's what they do. And I know this is a really gross analogy, but if I put a tampon in a ketchup bottle and I pulled it out, all the ketchup would come down, right? That's what happens when the baby comes out vaginally. So you're a little more set up for success, but many women have to have a cesarean and the organs are just dropped back where they look like they belong. And then you carry on, right? And so that's another thing we work on, or I specifically am trained in, is visceral mobilization. So like quieting the bowels down, putting the stomach back. Everyone needs to rest. Otherwise, we have a very important nerve. It's called our vagus nerve, and it runs from the base of our skull pretty much all the way through. It goes behind our uterus. And our vagus nerve is the one who says, run, go, somebody's chasing you. Or it's the nerve that says like, oh, I'm warm. I'm sitting on a beach chair. My kids are doing great. And you feel that calmness. The problem is most of us have dysregulation of a vagus nerve. So then with that disruption of the baby, and birth is traumatic. It can be the most beautiful birth in the world, but you have had so much happen to tissues, into organs, into muscles that nerve sometimes never quiets down. So that's when we also see a lot of anxiety, more nausea, also feeling like you're going to faint when you poop because those are type of things of vagus nerve kicking on. So a lot of times we talk about that as well because it has a huge impact in being while you're in birth as well as postpartum.
Wow, mind blown over here.
Somebody fix,
and I've already seen.
I'm coming to California. Just fix all my organs for me, okay? Because
and that's a tricky. Like it is tricky to find people. But I just always say, like, we know our bodies best, and kind of what you said, like we are mothers and we are machines, and we push out this baby, we tear, sometimes 4th degree, which means we went through our rectum, and someone handed you a baby with a couple stitches and said, right? And you do it because you have other kids at home. But the problem is the pelvic floor will show up. It's like, cool, I've got it. Here's the problem. The likelihood, let's say you leaked in pregnancy, so you had stress incontinence and your doctor said, it's totally normal. And then you have the baby, you're like, oh my gosh, the stress incontinence is gone. 2 things. 1, your pelvic floor just got so traumatized, it locked down really tight so you can't leak for a period of time. This current statistic is a woman that leaks in pregnancy but does not leak in postpartum has an 85% chance of complete incontinence in menopause.
Okay, well, that is rude. That is not okay with me.
So that's what we're trying to change is like, yes, your body adapts, but you're young, you have estrogen, you have progesterone, your testosterone's great because you're 30, 40. When you start to get in perimenopause, you don't have those hormones helping you and your pelvic floor is done. And everyone's like, cool, we're done. And that's when we see a lot of crisis too. So I try to really say like, I know you have a lot going on and I know your symptoms got better, but they're hiding and they're waiting for me to come find them. And you'd rather me find them now than find them when you're 50 and you're losing control of your stool and your bladder.
Oh, is it common to lose control of your stool as well as you get there?
With poorly treated tears. So anything beyond a grade 2. So if you think about grade 2 is pretty much into the perineal body and a little bit into the muscle. Grade 3 is that you go into the external sphincter of your anus, and grade 4 is into your rectum. Anything beyond a 2, the likelihood is higher because you damage the supporting structures to your bowels. But again, and when we're young and healthy, for the most part, we can compensate, but compensation finally gives up.
I can't wait to do the video clips of this episode because the facial expressions as you're like describing some of these things are just like, it's so much pain, just feel so sad for people because I've heard a lot about like incontinence, but I've never heard anybody talk about like problems with their stool and losing control of that. And
so
it's because it's like nobody wants to talk about that.
No, but I will tell you the number one, the number one postpartum complaint from women. I have a little survey of questions is we call it fecal smearing. So you wipe and you wipe and you wipe and you wipe. You should wipe twice. If you're wiping and wiping and wiping, there's a problem. If you're losing gas from your rectum, it's a problem.
What does that mean?
Oh, that's not just normal.
What does that mean?
That's just not funny.
I mean, you should fart, but you shouldn't be like walking. You shouldn't be like walking across the hall and be like, "Whoopsies, that one snuck out," because it tells us somebody's not doing this. Yes, crop dusting is not normal.
Grandma crop dusting through the living room.
Yes,
because grandma didn't ever address her tear she had. Okay,
exactly.
That's fascinating.
Exactly.
So after I had my kids, I thought something went wrong down there because of this thing you're describing, like needing to wipe and wipe and wipe. And I was like, I don't know, maybe I have maybe I prolapsed. Maybe there was something like that. Like maybe something's not structurally right down there anymore. We got the Tushy, like the bidet, and that has solved that problem for me. But now I'm realizing there's a problem I didn't realize I had possibly.
Yeah. And now
it's like the number one that women are like, oh.
Yeah, what the hell, man?
Yeah. I told Brittany Pomfret this one day. I'm surprised she didn't know this was an issue because I was like, I don't know what's going on down there now. This is really gross, but I had no idea. That's fascinating.
Yeah. So typically everyone's really focused on prolapse, which is when we let the essentially in your vaginal canal, your organs can come in. So most women are like, oh, my mom had a uterine prolapse, which that's pretty common. But bladder prolapse is a 50% chance of bladder prolapse after birth. So because particularly if you hold your breath and push, if you didn't come see me for birth education, then what happened was you locked your pelvic floor down and your poor bladder just got taken through. Baby took the bladder and you just shoved it all out. Then the bladder was like, I'm a little stretched. So a lot of women will be like, you know what it feels like? I'm wearing a bad tampon and it's like falling out, but I don't have a tampon in. Or I go to sit down and there's like a heavy bulge, or, I walk and I'll wear my kiddo in the ergo. And then when I'm done, I want to hold my vagina. Those are all signs of prolapse. But what we're kind of like skating over is like, well, I'm not leaking. It's fine. The problem is those have risk factors down the road and they really impact your ability to empty your bladder and empty your bowels. So those are always things that I'm kind of reminding people of is like, I hear that you want to go running. You're a runner. You want to run it 1 month postpartum, 6 weeks. I'm just going to give you a big no, because there's been so much work on those tissues that the likelihood of prolapse gets higher as you continue without proper education and training of the muscles.
Okay. On this comment of 6 weeks, how do you feel about sex 6 weeks after having a baby?
So it depends. One, if your provider did not examine you, did not check your stitches, did not look at your tear, did not look at the tissue quality. When we are breastfeeding in particular, our estrogen drops. Our poor, sad vaginas do not like that. So your OB should be looking at all those things. So if they come in and say, hey, how are you doing? Did your bleeding stop? Are you breastfeeding? Are you depressed? Cool. And they leave. You call them back in and say, oh, could you do an exam? I'd like you to check my tear, episiotomy, scar, whatever it is. I'd like you to screen me for prolapse. And then if I'm cleared for intercourse and it's painful, what do I do? Because a lot of times it's have some more tequila, use a bunch of lube, make your husband work harder for it. But if your muscles are tight and there's no estrogen providing lubrication, you got no chance, right? And so we talk a lot about, okay, is it the tear? Is it the muscles themselves being too tight? Or do we not have enough lube? All three, some. Or your poor pelvic floor has been traumatized, and so it doesn't want to do it. So we have to then talk about how do we make it want to do it? How do we help it feel safe and help the tissues want to be aroused? That's half the problem.
I'm going to go ahead and say my answer is absolutely no. Like, don't come near me at 6 weeks. Like, absolutely not. Like,
yeah,
no.
You know, 6 weeks is created off the idea. It's created off the idea that you can't get an infection anymore. That's what it is. That's what the 6 weeks clearance is that your cervix has closed enough that your husband or whatever's coming in can't introduce an infection. That's the only thing we know it clears you for.
Okay. Well, I don't like that rule, and I think it should be longer because get away from me. Like it's honestly, good for anybody who feels really great at 6 weeks, but at 6 weeks, like,
right.
I was like a deflated balloon that was saggy and leaking and tired and like emotional. Like, nothing felt good about any of that situation. Like, go away.
I have an alternative perspective on that. I was so like lonely in my motherhood that like I desperately wanted that connection with my husband and like needed to have like that grown up time earlier than probably most. Not because I was like needing arousal or anything. I just like really needed that very close connection because I was lonely and depressed and anxious in every other part of my world. So
interesting.
So I just like needed to feel secure in that, I guess.
Yeah, and for some people, it's not a problem. Yeah, I mean, there's so many factors when it comes down to it, but I would say after 1 or 2, maybe 3 max, and it's still uncomfortable, you have to seek help. It's just, I always use the analogy, which like you say that, but I'm like, if I walked past you and I hit you 3 out of 4 times, like really hard, when you walk by me, are you going to be like, hey, Lauren, or are you going to be like this? Right? Like you're going to be fearful. Your pelvic floor it's not their first rodeo. You know, they did a study where they put sensors on women's pelvic floors and on their jaws and necks because most women be like, oh, when I get stressed, I get really tense here, right? And so they showed stressful images. The pelvic floor responded 2 times faster than any muscle in the body, and the clients weren't even aware of it. They had no idea it had happened. So before even like, you know, the kids are down, your body's already like, oh, he's going to try to have sex with me. And I already know it's not going to go well. Right. And now you're already halfway out the door and the success is so far down. And then we just go down this darn rabbit hole and it causes more issues than I can imagine. I mean, these poor mothers, right? They feel like failures. They can't be a good partner. They're having a hard time breastfeeding, whatever it is. It's because it's not normal for it to feel good, especially if you've had any type of trauma to the pelvic floor.
So what are a lot of the reasons that people come to see you?
I'd say the biggest issue is leaking of some sort. So typically stress incontinence. I will say a lot of moms come for just this generalized pelvic pain. What a lot of people don't realize, although it seems pretty common, is that the pelvis makes such significant changes to allow a baby to get out that the then pelvis is stuck like that. And it's not a normal position. The muscles are on stretch. There's a lot of catching. And I will tell you, most postpartum women will say, at my back left SI joint hurts. It catches. I have a low backache or my tailbone. Is that you?
Then I am most people because
Right.
100%. Like right now, I'm sitting here pushing on my back left SI joint because it hurts.
Mine clicks in and out.
Correct.
Yeah.
So we call that the open birthing pattern. And then myself, for people who are trained like I am by the Holistic Birth Institute, close it back. And people will get off the table and be like, what did you do? And I'm like, we just closed your pelvis. Like your pelvis was open for a baby, and it can be 10 years later, 15 years later. So I'd say back pain is a big one, painful intercourse as well. And then I specialize in pain, particularly endometriosis, which is my passion. You know, people who have chronic pelvic pain go 7 to 9 years before somebody tells them that it's probably endometriosis. It's like the number one gaslit diagnosis I've seen. And it's heartbreaking to me. The amount of misinformation for women's health, particularly around surrounding an issue that is life altering for these people. And all we're told is it's just really bad cramps. It's not. You have endometrial tissue growing outside your body in places. I mean, I've had clients have it on their diaphragm, on their psoases. And I'm often the first person who says, has anyone told you have endometriosis? And they look at me like, what? I've always thought that. And everyone said no. And I'm like, well, no one knows the truth because you don't know. Unfortunately, you can only be diagnosed via surgery, which is rough. But there's often signs of that. So that's another big passion of mine. Yeah, is that.
And you can help people with that.
Yeah, I mean, I always joke I'm kind of like your coach or your guide. I try to get you in touch with the best surgeons. There's not many. There's about 2 in California that we trust to do excision. But, you know, a lot of it just comes down to being safe and feeling heard. And that's what I want you to feel like when you're in my office, that I've heard every concern of yours, that I've clarified, okay, I'm hearing this. Is it this or is it that? Which one is that? Okay, great. And oftentimes it's a team. You need acupuncture, you need functional medicine. Your gut is extremely disrupted postpartum, which a lot of people will notice. So using a functional medicine provider because you're completely autoimmune while you're pregnant and postpartum, right? And sometimes then your body spins down that rabbit hole. So really putting together a team of providers that calms the nervous system, treats the victims of endo, and then finding a surgeon who gets rid of the endo is typically my priority. But I value myself that I work in a really great network of people in SLO that you need functional med, I got you. Do you need an acupuncture? I got you. You need a body worker or lymphatic drainage specialist? There's people that are good at this. We're just not hearing about it at our doctor, you know? They're just not providing it.
You're kind of like a realtor.
I wish
how we have everybody for the house. You got everybody for the other stuff.
Exactly.
When Cheryl already said this once, but I wish our audience could just see my face this whole time. Like, first of all, my eyes are going to bulge out of my head because all the things you're talking about are things that, you know, like I feel like I had 3 really normal, regular kind of pregnancies and 4 because I was pregnant prior to my first child, which I think is also something that, you know, having 4 pregnancies in 4 years is a lot also on your body. But like when you talk about all the different parts, like when you talk, like literally everything you just said, I was like, oh, that's me. Oh, that's me. But I don't think of myself as having any problems, although I have chronic back pain and I just deal with it. Or I go see my chiropractor and it never really gets fixed, or, you know, like I do the exercises and the stretches and it's fine for a bit, but then it comes back. Or like talking about just like having digestion or you know, like intestinal problems. Like I've had indigestion since pregnancy. I never had that before.
Oh, interesting.
Like things like that all the time. Like I'm just like, oh, I just deal with it. And I think that that's, you know, such a female trait, right? Like a woman trait is we're just like, oh, all this shit's going on, but like I'll just deal with it. Like
I'll get to it later.
Imagine how high we could function. Yeah, imagine like how the high like we function at a high level. Imagine how much higher of a level we could function if I wasn't constantly thinking about my back pain or constantly, you know, like not worried about like what's happening with my stomach or my, you know, whatever.
Or imagine how much better you could rest if you weren't in pain.
That's what we always talk about.
Flip side of it, you know.
Yeah.
Yeah.
I can't rest at all. I can't
Well,
rest
and
all.
I think it's the biggest challenge in my field is that we know we need to do self-care. We need to take, mindfulness and take a walk and move our bodies. And you're like, well, I also have 3 kids. I run a household and I have a full-time business. And so I try my best to be like, what can you give me? 10 minutes a day? Can we do 10 minutes? Is it driving in the car? Like trying to really figure out like, where can we make this effective for you? Because at the end, yes, we power through and we survive. But the statistics tell us that yes, we can do that because we're young, and our hormones haven't bottomed out on us, and we haven't started losing bone mass, and we haven't started losing muscle strength yet, but we will. Once you turn 30, which is really fun, you lose 10% of the striated muscle around your bladder sphincter a year. It's gone, and you don't get it back. So if your bladder neck is already kind of sad because it got stretched during childbirth or you strained to pee, you're in trouble. And there's not a lot we can do about that other than support the structures around it. And so that's what we're trying to change this conversation to of it's not just the peeing or it's like holistically mothers need or birthing people need better care that gives us better quality of life for us to live our life when our kids have left. We have a whole other life ahead of us, right?
I'm looking forward to that one. Love you, kids.
Are we all?
Okay, Lauren, tell listeners what they could expect if they went to visit a pelvic floor specialist. What would an appointment look like? What should it look like? What shouldn't it look like?
I was going to say, I can tell you what it looks like to see me. I also try to share like common red flags of like, I think I'm in the wrong place. But typically there should be a pretty intensive medical intake that covers pretty much your current symptoms, your history, talking about a variety. If a client or a practitioner is only talking about your bladder, they're missing something. I will tell you that I treat rectally a lot and people's eyeballs are like this and they're like, you're going where? I'm like, listen, it's all the same group of muscles, different spot. If you're having pain that has not resolved and you're not being treated rectally, you're at the wrong place. Which is not a great thought that you have to do that, but that's one of them. But you'll have a rather intensive intake just to give us as much information as possible so I know how to approach you. If you've had traumatic births that included vacuums and being forced to birth on your back and an unwanted episiotomy, that's going to change the way I touch you and I approach you. If you're real straightforward, you have, clear-cut goals of, hey, this is my only problem. I only leak when I jump. I want to fix that. That changes how I approach you. But all session essentially includes talking about the pelvic floor, showing you what it looks like on a model, showing you what's happened during childbirth or your trauma when you fell on your tailbone. And then it's really like a top to bottom assessment. Like I'm feeling you energetically, which feels a little wooey. One of the midwives in my office is like, you're kind of like an energy worker. Do you know that? And I do think I do clear energy that has been stuck from birth, but I don't really specialize in anything. But I will feel you. Is one side bigger, tighter, moving differently? Then we look at your breathing, your rib cage, like we talked about. We will check for DRA, diastasis rectus abdominis, which is everyone's favorite hot topic right now. That is a whole thing in itself. Width is different than depth. So we'll talk about, are they separating? But when they separate, do I hit something hard or do I fall and touch your guts? So we talk about that. I then touch a lot of ligaments, your anchoring ligaments for your bladder, for your uterus, for your bowels. And we look at your hips. We then will put you through a screening for hypermobility, which is very common. And we don't know what's going on there, but that's a big factor we're seeing. It's a screening tool. And then we take all of that information paired with your symptoms and I try to educate you on why I think it's happening if I do know. And then the most basics is good bowel and bladder health. We should poop every day, maybe 2 to 3 times a day. If you are missing a day of pooping, you're doing it wrong. It's a little play on your podcast. And you should be peeing every 4 to 6 hours. 6 being the long end, like you're getting in a car ride, you have a big meeting. We should not be waking up to pee if we aren't 65 or older. I don't care if you're feeding a baby, you're not peeing. Okay. So we're not peeing when we wake up in the night. We should be able to hold our urge at least for 15 minutes. If you are walking to the bathroom and being like, oh, and I'm starting to trickle, that's urge incontinence. So I give the same conversation to everyone. Everyone's very familiar with stress urinary incontinence, which is I cough, I sneeze, I jump, I laugh, I run, I leak. That is stress incontinence. I will tell you we're moving that into more of like a symptom and not a diagnosis. That is a symptom of something else, but that's a type of incontinence. The one no one really understands or talks about is urge incontinence. So I'm walking to the bathroom and I'm leaking. I hear running water. I gotta pee right then. My daughter has to go pee. I'm taking her to the bathroom. Oh, I think I have to pee. I may have just peed 30 minutes ago, but now I have to pee. Urge incontinence is really funny. It is a brain bladder disconnect. And I don't mean it because they'll say the doctor said it's in my head, and it kind of is, but in the nicest way possible, which is when we potty train boys or girls, it's very different. Typically with boys, because they can pee in a bush or a public park and not touch anything, we don't really care so much. We just say, all right, let's go. Our daughters, hey, we're going to the park, you need to pee. Hey, mom's going to the bathroom, come with me. Hey, we're about to leave the house, go pee. You know what that turns into? Oh, when I see my purse, I always have to pee. If I walk past the bathroom, I always have to pee. What happened was when we were little, we didn't let our bladder decide. Our mom put us on the toilet and said, we got to go. You got to pee before we leave the house. And so you're sitting there being like, okay, I'm going to pee. And I do. And I get to go to the park. The problem is the bladder is doing, but I didn't say to go. Why are we sitting here? And so then it starts to be like, I guess the brain gets to call the shots. Well, the brain is a really funky little thing. And it might decide that when you're 3 streets away from your house, that's when you got to pee. It just starts picking up these little things. And so that's when we talk a lot about potty training girls is really important to encourage. How do you feel? Do you have to go to the bathroom? And it's the same for us in postpartum, is that there tends to be a lot of urgency because of the trauma. It doesn't mean you get to go to the bathroom every 30 minutes. It means we have to change that behavior, because that can be a very slippery slope for people. It starts of just feeling the urgency to need to pee when you're in a bathroom, but then that can get worse to just peeing before you even get out of your car. So that's the type of urinary urge incontinence that people get like totally baffled by.
That's so.
I literally have to pee now because you talked about peeing.
Yeah. See?
Like,
exactly.
I'm like, I have to pee.
Yeah.
That's so interesting about the potty training thing. And I mean, who knows about that besides you? Like, can you write a book? Can you write a book about potty training girls?
We call it jicking, just in case peeing. Jicking. So we're like, you're jicking all over yourself. Yeah. Because we just in case pee all the time. Or people who leak. Like you leak in gym class. So you're like, I peed when I left the house and I peed before I went into class. You're still going to leak. It's not about the liquid in the bladder. It's about your insufficiencies. But you start to just develop these habits thinking you're protecting yourself, and you're just making it worse. And that's a hard concept to get. And I spend so much time with people. But urge incontinence is actually the easiest treated. I can treat it in almost a session by just giving you the education and teaching you techniques to quiet the bladder when it shouldn't be talking to you.
So, Lauren, if we are in Central California, we can come and see you, right? But if we are not, how do we find somebody who does all of these magical things that you are doing? So I'm in Indianapolis. Like, if I'm like, how do I, like, is there a network that you have, or is there a way to do our research?
So there is a website called Pelvic PT Rehab Providers, and it's just where people launch themselves. I'm actually not even on the website because I didn't take the final test. I kind of pivoted into more of a holistic approach, and so I trained out with a holistic group in Colorado. But that's a good place to start. Honestly, Google reviews is the best thing you can do. Just type Pelvic PT Rehab near me, and then just ask questions. Are you trained in visceral mobilization? Are you familiar with closing the birth pattern? Or just be really specific, like, hey, I'm having left-sided SI joint. I can take it all the way back to my pregnancy. Are you comfortable treating this? Is this something you look at? I just think it's really important. Cheryl had mentioned biofeedback, which we probably met 3 years ago. How old's your daughter?
Emmy is 4. So probably about 4 years ago. You were in that office. You're just moving into your office.
Yeah. So I don't even do biofeedback anymore because I think that system is flawed. I do think there's a time and place for it. But I would say if a practitioner is not putting their hands on you and in you, which sounds kind of weird, obviously with permission. But if you go to a physical therapy clinic and they say, oh yeah, we do pelvic floor, and all you're doing is like glute bridges and ab exercises, you're actually doing more harm than good. So I would just say, hey, are you trained in internal work? Do you do vaginal and rectal? Anyone who's had a vaginal birth or C-section, truthfully, needs rectal work as well. There is so much I'm sure those who have had vaginal birth can recall that it feels like the baby came out your butthole the entire time. It had nothing to do with your vagina.
Mm-hmm.
Well, you talked about pushing, and that's a whole nother thing. And, I know but I pushed for 3 hours with my first baby.
It's a long time.
Because I didn't know how to do it. And I was also so worried about pooping myself.
Yes.
Like I was so worried and embarrassed about that. And then finally they said to me, you've got 30 minutes or we're going to use the vacuum. And I was like, all right, we got to get her out. Right. So, but that 3.5 hours of pushing because I just wasn't doing it right. Right. Like that's like, there's gotta be, I probably did something really bad to myself during all of that. But it's just like nobody teaches you how to do that. And everybody talks about pooping on the table. And it's like a bad thing, but like but you have to push like you're pooping, right? Like, am I wrong? How do you push a baby out? How should you think about that?
That's fascinating, Colleen, that you said when they said they were going to get the vacuum, you suddenly were able to like push and get her out. When my OB walked in the room with August, she said, okay, get me the vacuum. And I was like, no. And she's like, okay, you can try. And I pushed twice and I had her out. All I needed, they were telling me not to push for hours.
I literally was like, just give me a chance. Like, just give me a chance here. And he's like, you've been pushing for 3 hours. And I was like, okay, but like, just give me a chance. And literally within like a half an hour, but to get her completely out. Right. So yeah, within a few pushes, I figured out how to get her head out and then we got there. But yeah, it's nuts. I'm like now going to fly to you guys and have her fix my whole body and then come back. And I'm like, who's coming with me? We got to do this. Can she travel?
She's having a hell of a time with childcare, which is have to be another episode. But she's back.
Yay, she's back.
I told Colleen my story about my OB walked in and she said, okay, get the vacuum. And I was like, no. And I pushed twice and had her out. But they'd been telling me not to push for like 45 minutes while they were waiting for her to arrive, which is a whole different set of hell.
Oh, yeah. So I pushed for 3.5 hours to get my daughter out because I didn't know how to push. And I was afraid of pooping on the table because that is a fear that I think new moms have. And I think that we all talk about it as pregnant women who are going to give birth. Like, I don't want to poop on the table. I don't want to poop on the table. And I was so afraid of pooping on the table, which now I've said this 100 times in this podcast, but that I couldn't figure out how to push my daughter out. And it wasn't until they were like, we're going to bring the vacuum out, like that. They were like, okay, well, you've got 30 more minutes of pushing because that'll be 3.5 hours of pushing and your daughter's going to go into distress. And then we're going to bring the vacuum out. And I was like, oh, hell no. I did not do all this work. Like, and there was also like a pride thing. I was like, I am going to push this baby out because I have done all this work so far. And it's not like there's any problem, if that's what you have to do. But I finally got her out because I just let go of this idea. And they were like, push like you're going to poop. And I think it's just something that we don't know how to do.
Yeah. Which is true. To be honest, that's when we poop and give birth, they're the two things that mimic the correct movement of the pelvic floor. Otherwise, kind of back to that diaphragm philosophy, when we inhale and lengthen, that's what should be happening when we deliver a baby and when we poop. And so I think we do have to let go of the pooping thing because there's so many bodily fluids. I've witnessed a lot of births now that I'm in this, and it's like one of many very odd looking things that happen.
Yeah, and the nurses just sweep it all away so fast.
Scoop
they
it
don't
away.
care.
Exactly. Yeah. So I do tell people I'm actually in the works of creating a birth course because so many people have been like, what you taught me was life-changing. But in a perfect world, 30 minutes is actually too fast and 1 hour is too long. So we shoot for a 45-minute pushing phase. And we talk a lot about what you can do to control that experience. A lot has to do with your hip and pelvis. So we talk a lot about position, but really it comes down to breathing. And I tell people everywhere, you inhale to open your pelvic floor and then you shove the baby through that door. But you have to open the door. So if you're fighting a wall of muscles that's been tight your entire pregnancy and maybe since your first or third or 10th baby, or you've had pelvic floor dysfunction before you even got pregnant, that pelvic floor is not going to move unless you know how. You're going to just barrel through it. And that's what we want to change. That's where the maternal injuries come. That's where fetal distress comes. That's where these conversations start. I obviously believe there's a time and place for intervention like a vacuum or a breath holding procedure, but I think we can do better. I really
I was going to just say that where can people find you and watch you and know when this course is coming out, and how can we learn more from you?
And will you travel to Indianapolis?
Yeah. So,
listen, Taylor Swift is going to be in Indianapolis next November. If you want to go with me, I want to go really bad. I'm going to go stay with Colleen.
I mean, I've never been. I'm not opposed to it. I would say that Instagram's the best place. That's where I'm actually collecting data to figure out what is, and that's what I've been doing, is just kind of like, what did I teach you that was really your light bulb moment? And trying to do more classes because I can't reach everybody, but we have to do something about what we're doing to mothers locally and obviously all over the country. But Instagram's kind of where we're starting. The real hope is to get it up in the next 2 months. And it's just small group learning where we really talk about this stuff. I call it the shit no one talks about, because no one's talking about things that you can change, like things you get to impact. You walk into that birth and all you've learned was what 10 centimeters look like. And sometimes those birthing classes, they're just teaching you to be a good patient in the hospital. And that's not really what you need to know.
No, in fact, I think you're better off if you're not being the good patient and you're doing it your way and not following their rules.
Exactly.
I have to tell you these two things, and I know we are running quickly out of time, but let me tell you these two things. One, I went to a birthing class and they handed up ice around to everybody. They said, hold it in your hand for 30 seconds or something like that. They're like, that's how long a contraction lasts, and that's how a contraction is going to be. And let me tell you, holding ice in your hand for 30 seconds is like not even close to what a contraction feels like, especially if you're like on Pitocin contractions. That's a whole nother level. And two, when you said the 10 centimeters thing, when I was having my first baby, I couldn't dilate. Like, I was so tense. I was trying to have her naturally. I couldn't dilate. And they showed us the diagram. They're like, you're at 3 centimeters and you've been doing this for hours. And you need to get to 10. And they showed us the diagram of it. And my husband looked at me and he goes, that looks like a fucking dinner plate.
It's pretty much that's probably realistically what it looks like.
God. Yeah. And I was like, oh my God, how am I going to do this? And it wasn't until, to your point of this stress and like holding on, I didn't want to have an epidural, but it wasn't until I had an epidural that my body could relax. And I went from 2 centimeters to 7 centimeters in half an hour because I was so
And some people
out.
need them. I tell people all the time, there are tools that you get to use, but use them and be informed with them. And that's really, as my job, all I want to do is help you. So if you come in being like, I want an epidural, blah, 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 great, let's do it. But the problem is no one knows how to birth a baby. There are a few who are beautiful. They have no pelvic floor dysfunction. They've had 5 babies. They exist. But unfortunately, the world that we're living in post-COVID, we have seen a 60% increase in pelvic floor need just from COVID. So anxiety alone. You know what I mean? So we have to acknowledge that, yes, birth is very physiological and natural in nature. It is not that anymore now that we have pelvic floor dysfunction. If the group of muscles that is supposed to let the baby out doesn't know how to give, we're in trouble. And that's what I'm trying to help people understand.
Amazing. Well, you're doing amazing work.
The OBs don't love me for it, but thank you. I appreciate that.
The OBs need some more training in this then, or stay in their lane and let you do what you do.
Yeah, there's some groups that are super responsive. They're wonderful. We play really nice in the sandbox together. And there are others who just are not in it. And I All I can do is try and educate and empower. I'm a big fan of doulas. I believe you should take a doula with you to your delivery because you need somebody that's there only for you. Your partner's like, they're worried watching you. They're not going to be able to step up. Some can. But unfortunately, we have to work at the confines that we're in. And that does require just more gusto on our end of just saying, hey, we're not going to do it like this anymore. And that's my hope, is that we change. I tell my husband all the time, I'm doing it for my daughter to hope that she doesn't have to go through all the pelvic floor dysfunction and fighting the OBs and feeling unheard and unsafe.
Yeah, amazing.
Oh, you gave me goosebumps with that. Okay, Lauren's Instagram is at Lauren Edwards Pelvic, and it'll be in the show notes for you guys if you want to, and I'll put all her other details in there too. But Lauren, thank you
much
for such a real conversation.
Of course, it was so fun. I appreciate it.
Yes, it was so great. And when you have your class back ready, if you're going to do an online kind of course, then we'd love to have you back on and make sure everybody knows about it.
Cool.
Awesome. Well, thank you
I love that.
much.
Thank you guys. This was fun.
And that's a wrap for another fantastic episode of We're Doing This Right? Thank you all for joining us on this journey of laughter, leadership, and growth.
We hope you enjoyed diving into our conversations as much as we enjoyed bringing them to you. Remember, you're not alone on this path to success. We're right here with you every step of the way.
That's right. Before we go, we do want to remind you to hit that subscribe button so you'll never miss an episode. And if you found value in today's conversation, we'd be so thrilled if you could leave us a review on your favorite podcast platform. Your feedback means the world to us.
And don't forget to share this podcast with your friends, family, and anyone who could use a good laugh and some practical insight into navigating the challenges and triumphs of life, work, and everything in between.
Take care, everyone. And remember, we're doing this right.
Right?